Today, let's talk about HIV. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, specifically the CD4 cells that help the body fight infection. When these cells decreases, the body becomes weaker and more prone to illnesses. Without proper treatment, HIV can progress to AIDS, which is a more serious stage of the infection. Now, let's talk about the etiology or the causes of HIV. A little history lesson: the etiology of HIV is its origin as a virus, likely from a related chimpanzee virus called the simian or the immunodeficiency virus, which is believed to have crossed into the human population through contact with infected blood from hunting. Also, the most common ways HIV is transmitted is by sharing needles or syringes from mother to baby during pregnancy, childbirth, or breastfeeding, and blood transfusions of contaminated blood.
This is because HIV is spread by infected body fluids into your bloodstream. This includes blood, semen, and vaginal fluids.
However, you cannot get HIV from simply kissing, hugging, or shaking hands, by sharing foods, drinks, toilet seats, or any normal household items like cups or cutleries.
Signs and symptoms. HIV symptoms appear in stage early signs 2 to 4 weeks after infections. Often resemble the flu, including fever, sore throat, swollen lymph nodes, rash, headache, muscle aches, and extreme fatigue. After this, many people may have no symptoms for years, though some experience persistent swollen glands or frequent minor infections. HIV progress without treatment, more serious symptoms can develop, such as a rapid weight loss, fatigue, recurring infection, skin problems, mouth sores, shortness of breath, and memory or concentration problems.
Now, let's discuss diagnostic and laboratory testing for HIV. HIV is diagnosed using tests that detect either the virus itself or the body's response to it. The process has three main steps: screening, confirming, and monitoring. We begin with screening tests, which are fast and reliable. The first step is the HIV antibody test, which detect antibodies produced by the body after the infection. These tests became positive around 3 to 12 weeks after exposure and include rapid tests in home self-kit. Another commonly used screening method is the fourth generation antigen antibody test, which detects both the HIV antibodies and the early P24 antigen, allowing HIV to be identified as early as 2 to 6 weeks after exposure. For confirmatory testing, we use tests that officially diagnose HIV. One is the HIV-1 and HIV-2 differentiation assays, which identify whether the person has HIV-1 or HIV-2 or both. Another is the nucleic acid test, NAT, or the PCR, which detects the viral RNA directly. NAT can identify HIV as early as 10 to 14 days after the exposure and is issued when early infection is suspected or when results are unclear. Once HIV is confirmed, monitoring tests are done to assess the patient's immune system in treatment effectiveness. The CD4 count measures key immune cells and helps determine disease stage. As CD4 below 200 indicate AIDS, the viral load test measures how much virus is in the blood with the goal of reaching an undetectable viral load, meaning the virus cannot be transmitted. Drug-resistant testing is also done to determine which medication will work best, especially before starting treatment or if treatment is failing. Altogether, these tests ensure early detection, accurate diagnosis, and proper long-term management of HIV.
Now let's tackle the management of HIV. First is the pharmacologic management. For HIV, the main treatment is antiretroviral therapy or ART. This is a mix of medicines that helps lower the virus in the body. Taking ART daily helps the patient stay healthy, prevent complications, and reduce the chance of spreading the virus to others. Next is the medical management. The patient needs regular checkups, especially CD4 counts and viral load monitoring. Doctors also check for infections and other conditions because HIV weakens the immune system. Vaccines and treatments for other illnesses may also be given to keep the patient protected. Lastly, the nursing management. As nurses, we give health teaching like taking medicines on time, safe sex, and avoiding sharing needles. We monitor for side effects of art, encourage good nutrition, and support the patient emotionally, since HIV can affect mental health. We also make sure the patient understands the treatment plan. And now, how can we prevent HIV? To prevent HIV, we need to practice safe sex, like always using condoms and avoiding unprotected contact. Never share needles or any sharp items that can pass blood from one another person. It's also important to get regular HIV testing so you always know your status. People who have higher risk can take PrEP or pre-exposure prophylaxis, a daily medicine that builds protection in the body to help prevent HIV infection. If someone is exposed, they can take PEP or post-exposure prophylaxis, a medicine taken within 72 hours after possible exposure to stop the virus from entering the body. Good education, awareness, and reducing the stigma help keep everyone informed and safe.